Have you ever wondered when to stop taking your daily supplements when you have a scheduled surgery? And even further, what to take before your surgery? That's what we're talking about today on View on Health. Hi, I'm KRISTEN LASCOLA, host of View on Health. I'm here with Richard Hall, the head of research and development for Ameriden. So Richard, a lot of us are supplement people. We take our supplements every day because we want to increase, maintain, and sustain our health. But let's talk about the scenario if we have a surgery coming up. Does that change our relationship with our supplements, and how should we navigate the time prior to our surgery?
Yeah, KRISTEN, that's a really good question. People don't realize that 250 million people a year go under major surgery. Now, we're not talking about just the abrasions and the little sutures you get in the hospital, which is 3 times more, but major surgery. Now, that's 1 out of every 25 people in the world. And 86% of America uses supplements every day. So that's a really good question. Should we stop supplements? Yes, is the short answer on that. We should stop that for many good reasons, because during surgery, supplements can affect anesthesia, they can affect your pain level, they can affect your bleeding. And in fact, there was one instance that I researched about 6 months ago where a young man woke up in the middle of surgery, and they don't know why, but they found out that the young man was interviewed before, and he said he hadn't taken any supplements for 2 weeks, and they found out that he had taken ginkgo biloba and aspirin just the day before. Oh. So there is some attribution to why we shouldn't take our supplements that we love to take just before surgery. There's another question that goes along with that, and that is, well, what foods should we eat before we go into surgery? Before 2 weeks, you should start on like leafy greens, dark leafy greens. Start eating oats, start eating beta-1,3-D glucan or any beta-glucan products. That's gonna get your immunity up. And certainly start taking a K vitamin, because K vitamins are gonna start your coagulation and have a good healing process.
So you're saying, just to kind of put it in a nutshell, that we should stop all supplements?
All supplements.
And then what is the ideal time frame to stop that? Are you saying 2 weeks before our scheduled surgery date?
Yeah, many surgeons are going to say 14 days, and a lot of other surgeons will say 7 days. So I would say give your minimum days, 7 days, up to a maximum of 14 days before you actually go into surgery.
What about any other vitamins I'm taking? Should I stop my vitamin B12? Should I stop my vitamin C, my vitamin D? Or are those all okay? Are we only talking supplements?
Stop all of them, according to the American Medical Association, on all the JAMA writings. Stop all of them, because they could have the potentiation of higher bleeding, more pain, waking up during anesthesia. It can also affect anesthesia, so you don't want any of those to occur. The other reason is when they're using medical drugs, when you come out, those medical drugs are trying to heal your body with drugs. And so you don't want to interrupt what those drugs are doing. And sometimes natural supplements can be contraindicated. They can have a cross-out effect. Equal amounts will stop it from working. You want the best outcome for your surgery.
And I'm so glad you mentioned this, because a lot of times, I don't know about you, but when I go to the doctor and they ask for my list of medications, I just tell them the medications I'm on. And sometimes I feel like, yeah, mentioning my vitamins and supplements and all that is just kind of like fringe, and I don't really need to say it. But this whole episode really gives me pause to say, hey, there's a really good reason that my surgeon or my doctor might want to know the supplements I'm taking as well. So that is so good to know, because obviously none of us want any adverse effects when we're dealing with something as serious as surgery. Well, thank you so much, Richard. That brings so much clarity to kind of a serious situation that none of us want to find ourselves in.
Absolutely.
And then on our next episode, we're going to be talking even further about now what to do after surgery when it comes to our supplements. We'll see you next time.